I think everywhere I go now I see evidence that people are paying more attention to recovery. Certainly the way that services are now working with service users and their families to really look at how they can develop services that are recovery orientated. There's a very real shift that's now becoming very evident. Also in terms of how people are, I guess, using their resources, how people are prioritising recovery. And that's not just at a national level in terms of investment, but actually within teams and within community health organisations, people are actually prioritising recovery-based initiatives. So for me, going around the country and seeing services, it's becoming increasingly evident that people are actually doing a lot more, and there is definitely a shift. I think whatever about me seeing it, that's one thing, but I think we hear from people, so we hear from service users, we hear from other organisations that actually they are also seeing it, and that's actually more important, because I think it is about people's experience on the ground, and that certainly is becoming evident. The real strengths are that we're actually meeting people's needs in the way that they want them to be met. The mental health services can't be all things to all people. We'd be naive to think that we can do everything, and ultimately it is about working in partnership with people who use services so that we can best use the staff and the other things that we have available to us. So for me, co-production is about really trying to move people in a way away from our services back to whatever it is that they want to do, whether it's to work, whether it's things in their own community, but supporting people to actually lead, fulfill lives in the way that they want to. So I think there's definite benefits in co-production. I think there are a number of challenges really in terms of how we can progress this agenda. So we have certainly in some of our services there are really significant difficulties in having sufficient staff to do what we need to do. And I think for me it's about making recovery business as usual, so that it's not seen as an additional workload for people. This is how we should be developing our services and delivering our services. So I think there's a real legitimate challenge around just the time available. I think there's another challenge in terms of just getting people to buy in. So in different services we are challenged at times in terms of culture within services. People sometimes see it as a threat. They feel that recovery is different to what real service delivery should be about, and that's up to us to address in terms of showing the difference that recovery can make. So I think there's a lot of challenges. Expectations, making these kind of changes is slow, and we have to allow time for it to happen. So it's not going to happen overnight, and we are trying to change years of a culture, years of a different way of working in some areas. So we've lots of challenges, but I think we've reached a tipping point really, where we have enough people around now who actually are working in this space to be able to actually turn that around. So I think we have challenges, but none of them are insurmountable.